Welcome to the Legislative Advocacy Series Part 2, where we're going to discuss sexual assault and abuse public policy agendas. This is being hosted by the Kentucky Association of Sexual Assault Programs, and my name is Layla Cauchon, she, her pronouns, and I am the staff attorney here at the coalition. In case you missed part 1 of our series, where we discussed the Kentucky legislative process and tips for engaging in advocacy on the state level, be on the lookout for it to be uploaded to our YouTube channel by the end of the year. And a little bit more about me. I'm a believer that your voice can make a difference. I'm passionate to end gender-based and power-based violence, and I believe that we can do that. And I've also served in various roles over the past 20 years as a volunteer, an advocate, and as an attorney. So in case you're unfamiliar with the Kentucky Association of Sexual Assault Programs, we are the coalition for Kentucky's 13 regional rape crisis centers. They're also known as sexual assault resource centers. And at the state level, we provide assistance to those programs. We also coordinate prevention efforts, and we advocate for systems change, including in policy. And then the programs themselves, and you can see all of them listed here, they provide direct services to individuals who have been sexually assaulted or abused, as well as family and friends of those individuals. And a few of the services that they offer include counseling, therapy, a 24/7 support line, ongoing advocacy within the criminal legal systems, as well as hospital advocacy. So if someone goes to the hospital for a sexual assault forensic exam, or just for medical care to the emergency department after a sexual assault, an advocate from one of our programs will show up to provide support and information. And our programs also provide education to local communities as well as schools on prevention. And if you're a person who's interested in potential volunteer work, our programs also offer volunteer programs that after you go through a training, there are many options for what you could possibly do to help out. So by the end of this session, we're hoping that you'll know at least 2 KASAP priority policies. You'll learn about the National Survivors Agenda, and we're going to share a little bit about some related agendas and advocacy groups. But before we jump in, I'd like us to sit for a moment and just have this space to imagine, what does a future free of sexual violence look like? I'm jumping ahead just a little bit because this graphic was developed as part of the National Survivors Agenda during a town hall that they hosted as a part of gathering information to what the agenda would look like. And when this question was posed, there was a person who drew these visual notes for us to see what it meant to those participants and survivors if they were to imagine this type of world. So I want us to just sit here for a second, take a look, and really just dive into your hearts and think about what would it look and feel like if we lived in a world free from sexual assault and abuse. Okay. So now that we're centered in this space to imagine living in this type of world, let's figure out how we decide which policies to support or not. You can see this slide is more like a bingo card. And if you were to ask us at the coalition, which ones could we stamp, we would win on a coverall. We look at all of these things regularly when we're deciding what we look at, or excuse me, what policies we push or oppose each session. And so how do you even decide? Let's just go through each one of these. So I'm going to start at the top on the left. So first, we always want to make sure to review the most updated research and best practices. This will give us some ideas around whether what we've been doing is actually shown to work or is still the best data that we have so that we can make informed decisions. And then moving over, we also want to center feedback from survivors. A lot of survivors contact the coalition and ask for information around policy and whether or not what they think needs to change, and then how to do it. We also receive feedback from our staff at the local programs who are serving survivors, since they have key insight into what's going on in the systems and their communities around this issue. Additionally, we surveyed our program staff some time ago, within the last, I think it maybe was a year ago or so, to find out how many staff working in our programs were also survivors themselves. And we have at least half of the staff are also survivors. So when they provide feedback, they're not only doing so in their professional capacity, but also in their personal experiences. And when we go on that to the far right of that top line, we're also looking at the political environment. So even if we have an idea of a policy that has been shown to reduce incidents of violence, for example, it might not be fit for Kentucky to pass. It may pass somewhere else in a different state with a different political makeup. But in Kentucky, I mean, that is something, well, in every state, that coalitions and advocacy groups have to look at to figure out what would be reasonable to pass in their state. Going to the middle section, sponsor availability. And what this means is, so maybe we have a really great idea, or you come to the table with a really great idea, but then we need to find a legislator who also thinks it's a great idea and is willing to put their name on it to champion and lead the issue throughout the legislature. And so that's where it comes down to finding someone to take that on. Potential barriers could be not only, we mentioned political environment and finding a sponsor, could also just be that there's other opposition to the issue in and of itself. And so we'd have to look at that, figure out if there's opposition, which agencies or individuals that might be, and try to bring them to the table so that we could have discussions and figure out where we might align. And there could be other barriers that could just be resources. So maybe you don't have the time to put into how much effort maybe one particular issue would take to get moving, and that could be a barrier. So it might take longer to get the issue addressed. Other time sensitive needs, and what I'm getting at with this box is sometimes things come up during the legislative session that we weren't planning. And so there we have, and it might in fact be an issue that could be harmful if it's passed. A new law could be harmful to survivors in some way. And so we might have to spend our resources on that. Additionally, this could mean when it's a budget year in Kentucky, that's every 2 years, the state redoes the budget, the state budget, and the local programs under our coalition, the RIC crisis centers, they receive state funding, and that's a time sensitive need. So every other year, we have to make sure to prioritize requesting funding for those programs so that survivors can still access the services that they want and need. And then there's the next one over is potential harm or benefit on a larger scale. And what this means is we want to think about, for an issue, how much of an impact will it make? Will this reach a small number of folks or a larger number of folks? And we want to work on issues that reach both, because an issue that reaches even one person, that helps one person, you know, we want to help push forward. At the same time, when you have to balance lots of different issues that may be moving, it might mean prioritizing one over the other, depending on the reach that it could have. And moving to the bottom row, board and membership votes. Our coalition is a nonprofit that's made up by board members, and they also have a vote on what is prioritized each year, and as well as what our overall public policy document looks like. And so we have to take that feedback into consideration. And that's the same for many advocacy agencies. They do have board members or other members who give input into that decision. Hot topics. So this is one where we might see an issue being addressed across the nation. So many states might be looking at the same issue at the same time, and it's picking up steam. And a legislator or a survivor or someone else in Kentucky says, yes, we need to look at that here in Kentucky. And so it becomes a hot topic that will take precedence because it will have some movement behind it. And we want to make sure that it is the best possible version for Kentucky. Coalitions of support. So we're powerful when we're more, right? The more folks who are behind an issue, the more coalitions, the stronger and louder our voices can be. And when we have that, that's going to be a strong source of moving a potential issue. And so when we know we have that on issues that we really care about and prioritize, that can bump them up in priority. The last one is available resources. So I briefly mentioned this a minute ago around maybe you don't have a lot of time to put into this. That's okay. It just means that things might be slower, or we need to figure out how to build a larger coalition of support so that you're not the only one, or we're not the only one working on the issue. For myself, for example, the lobbying and advocacy part of my job is only part of my job. It is not my full-time position. And I am one person, so I can't take on every important issue because there are many. We did a survey, I think in 2018, around ranking issues, and I may have had 60 issues on there. So just to give you an idea of how many ways that we can try to address and reduce sexual assault and abuse, it includes a lot. And so we can't do everything every year. And even when we have coalitions of support, all these things that have to be brought in together to decide. And then most importantly, figuring out what's actually going to move at the legislature. Then that sort of reduces down where your focus can be. But again, that can still be so many issues that it's hard for one person to do. And that's another reason why it's really powerful and important to try to build coalition. Other agencies may have 4 or 5 advocates / lobbyists who that's all they do. And in those circumstances, they are going to be able to reach more individuals. They'll be able to reach more coalitions to ask for support, as well as more legislators. And so hearing from or being able to reach out to more legislators for an issue and educating them on why it's important for whatever cause you support, or why there are some concerns about it for whatever cause you support, is really key to advocacy. So now let's jump into KASAP's public policy positions. And to clarify, when I say KASAP, I mean the Kentucky Association of Sexual Assault Programs. So this was our public policy positions document was first developed many years ago, before my time. I've been here for almost 6 years, but we had something in existence before my time. And what we've done each year is review it. And we've made some modifications, maybe changing on wording or layout, just trying to make it clearer. And so that we know where we stand on certain policy issues, as well as we can share that with legislators and other folks throughout the Commonwealth so that you all know where we stand and why we stand in those positions. So a couple things we're going to run through here is the first thing on the policy positions document is state and federal funding. And this is on our general overarching document. And I mentioned how every other year, so every 2 years in Kentucky, the state redoes the state budget. So that is something we prioritize. There's also federal funding that our programs receive. And some of the main sources of that federal funding include the Violence Against Women's Act, as well as the Victims of Crime Act. And so we also want to make sure that those federal funding streams continue, and there are national agencies who we're under their umbrella who do that federal advocacy. We do send them information to make sure they know about what's going on in the states and any barriers or issues that we're having, so they can take that up to the federal government. We also realize that it's not enough to just provide services for people when they've been sexually assaulted or abused. So that's that response work, excuse me. And we've been doing response work, and we have to do response work, and it is important work because it's happening and we have to continue those services. But what we'd really like to see is that we reduce and end sexual harm as a whole. And so that means we have to step back and take a look at what are the root causes of sexual assault and abuse, and how can we prevent that? So the second thing on our public policy positions document is to promote prevention strategies. And so that includes stuff like teaching bystander intervention and addressing other root causes of sexual assault and harm. Survivors have various needs. So some survivors really need, they want to address things through the criminal system, and they have that need. Other survivors might want to have additional access to services or to resources to heal. And survivors want to have a choice in how they seek healing and justice. And so when we talk about addressing survivors' needs, that could be a lot of different things. And we want to make sure that we are being inclusive of what everyone might need. Next on our list is to improve system responses. So there are lots of small systems within our communities or our states, right, as a whole. And those, I put some examples on here, could be the criminal legal system, civil legal system, schools, prisons, and other systems. And what we see time and time again, unfortunately, is that the responses are not trauma informed, or they are not centered to make sure that healing is available for folks who are harmed within those systems. And so we do want to center improvements within those systems. The next thing is promoting public policy. There's a history of the narrative that if we just lock everyone up, then our communities are safe. We know that's not the outcome. There may be some temporary safety from certain individuals, but we know that that is not what's going to end sexual assault and abuse. And we also know that working in this field is very emotional, because you hear stories about people being hurt really bad and how that lasts with them for a long time and maybe forever. And we don't want that to happen. So sometimes we might react on a more emotional level. Now, this work has always has some aspect of an emotional level, so don't get me wrong there. But without connecting this public safety idea with what is actually shown to keep the public safe. So we want to make sure to center ourselves in that. And then next on the list is require professional education. And so that might include things such as certain professional groups who consistently work with survivors, or who may work with survivors, to make sure that they have the most updated information about how to work best with survivors. So making sure that they are not victim blaming in their response if someone discloses to them, making sure that they know the resources to share with those individuals, and just that they have the skills. So that could just be training on what the law is, how to listen, and how to respond. And the last thing on our list is protecting nonprofit needs. And the coalition, as well as all of the local programs, are nonprofits. So this issue has to be a key piece of our public policy positions. We are members of the Kentucky Nonprofit Network as a way to stay informed and to figure out which issues we need to be a part of or can be a part of. And that is a summary of all of the general sections of our public policy document. So now let's see what that actually looks like. I wanted to not just tell you what our public policy positions are, but also to share, here's what that looks like in practice and a few of the wins that we've had from issues pulled from that public policy document. So the first one is funding. We have been very grateful that in Kentucky, our legislature has upheld the importance of serving survivors of sexual assault and abuse, as well as just the importance of our programs. And so each year, when we've advocated for funding, we have received funding. Even if we've just said, please don't cut us, let's just keep the funding that we have, that's been successful. Now for 2022, we are asking for an increase in funding, and that's due to a couple of things. One, we've had an increase in requests for services. Two, we know that we need to do more primary prevention work so that people don't get hurt to begin with. And those are really the two big pieces. Next, we've had some wins around expanding the civil statute of limitations for survivors, and that's a two-part. There's a statute that allows adult survivors who have been harmed as adults seek potential remedy from the person who harmed them. So they might ask for things such as medical cost. But saying this, also a disclaimer that if you have been harmed by someone and you want to figure out if this would apply to you, we would encourage you to reach out to a civil attorney to have a consultation to figure out if any of this might be applicable to you. The second piece of this expansion of civil statute of limitations applies to folks who were sexually abused as children, and that's been expanded as well. So the expansion is for not only clarifying what's included under these protections or these remedies, potential remedies, but also the time frame. So for adults, there's a 5-year time frame. For child sexual abuse, there's a 10-year time frame. And then there are some other caveats within those statutes. So it is important if this is something that you want to see if it applies to you, to have an attorney to go in depth and review those statutes. But those are wins because they were much shorter statutes, and we've worked on them multiple times to expand them. There was also a push for protections for tenants, and what this means is if you have a private landlord tenant relationship, so you're renting an apartment from someone who, it's not a government subsidized apartment or anything like that, and you don't feel safe there anymore. We wanted to add another layer for folks to have this ability to change their locks or to break the lease early without penalty. And a few other things are included in those new laws. And they are narrow, so it's not as broad as we would like, but they will apply under circumstances, for example, where a person has a protection order against another person, or there's a no contact order out of a criminal case. And so for more information around that one as well, you can contact us, or you can also contact the Kentucky Coalition Against Domestic Violence, who led that charge. Next one down is Marcy's Law. Marcy's Law added state constitutional rights for victims of crime. It's much broader than just being applicable to sexual assault and abuse survivors, but also includes them. And what this law seeks to do is elevate the voices of survivors and victims in the criminal process so that they aren't just seen as someone on the sidelines, because this harm actually happened to them. And their voice should be included, and doesn't mean it changes the process as a whole. It's just another layer there. And so there are new rights. And for folks to read about those, I would encourage you to do an internet search for the Kentucky Office of the Attorney General. And on that website, they have a brochure around victims' rights, because there are state rights in the Constitution, but also in statute. So there are 2 layers there. And then they have a handout that just shows just the Marcy's Law rights. So if you or someone you love, or if you're just curious about the criminal system victim rights, that's where you can find some really easy to read information about it. Next is a dignity bill. There were 2 versions of this that passed in different years. And the dignity bill basically just is a very general, it did a lot of wonderful things for women who are incarcerated in particular, but it provided these options around maternal health when someone's incarcerated. And so this has been a big win. Child marriage, Kentucky previously would allow almost anybody to marry at any age, even if it was a very young person with an adult. And there were lots of concerns about health outcomes and abuse and inappropriate relationships and a lot of concerns there. And there was a survivor advocate who really led this charge around child marriage, and we joined and supported that effort. So now in Kentucky, the youngest a person can be married is 17 years old. And there are some other factors that must be met if the 17-year-old were to marry. The SAFE Act is the Sexual Assault Forensic Evidence Act, and it passed in 2016. It was a very large lift for our coalition and the state, and it addressed, it was really a nationwide push to begin with to check around each state to figure out if there were sexual assault forensic evidence kits that were never tested to see if there was potential DNA in those kits. And Kentucky found over 3,000, and that number has increased since then during an audit. And that audit and looking at research into what are best practices now around sexual assault investigations, that led to the SAFE Act. And the SAFE Act did many things, like some of these bills I've mentioned have done many things, not just one thing. A couple of the things the SAFE Act did was require training for law enforcement officers who are conducting sexual assault investigations to ensure that they have the most updated information around best practices. It also changed some timelines around how long we need to retain potential evidence that has DNA. And it did many other things. So the last thing on here is training for EMTs. When I mentioned one of our goals on the public policy document was to improve, require professional education. This is another area where we receive feedback that EMTs could use some additional training, and they also welcomed it. So that was really great. And now that is a requirement in law. I guess as a side note, I want to make sure that folks know sometimes it's not a state level change that needs to take place to address an issue. It could just be collaborating with an agency where we see a gap to change their policy. It could be creating a memorandum of agreement or understanding to partner together to address an issue. One example would be with the Administrative Office of the Courts here in Kentucky. They are in charge of developing the forms that people use to apply for a protection order. And we've heard that they can be confusing. And what does this language mean? And we want to try to make it as easy for folks who need to read those forms or use those forms to apply. So we've been able to send them feedback and say, hey, here's some ideas. If possible, let's integrate these to make it easier for folks to use. That did not require a state level change. It only required partnering together and having both us and them willing to have a conversation and try to address those concerns. So I mentioned in a couple of the past wins how we didn't lead the charge. And I think that's important to know that for wins to happen, when we come together, we're going to be more likely to make an important difference. And so some of the things that we have here when we work together wins happen. We have grassroots effort, and that includes just the people of Kentucky speaking out and asking for change, contacting their legislators, social media efforts to push for change, partnering with organizations. And I mentioned the Kentucky Coalition Against Domestic Violence for the Tenants bill. We're partnering with them, for example, and then survivors. And I mentioned how with the child marriage bill, that was a survivor-led bill and effort, and we partnered with that person. So it's really beautiful to see everyone come together and make some really helpful, great changes for Kentucky. So what I shared a second ago is a really hefty public policy priority document. And what we did this year for 2022 is we tried to pull from that larger document and highlight a few important issues that we thought could move, or that we just want to make sure to keep them on the radar for folks. And this is a new thing that we added for the principals, and it came out of having conversations over many, many years with legislators and partners when they're asking like, well, why are you supporting this and not that? And just asking follow-up questions. I wanted to help us be centered in understanding some of the things that we make core in our principles when we're deciding what to push or not. And so I'll just read these over for you all. Number one is we promote policies that create safe and healthy environments, reducing the likelihood of perpetration and victimization. Number two, meet basic human needs so individuals can thrive and heal from sexual harm. Number three, pass laws aligning with research about best practices to address sexual harm. Number four, recognize that survivors have different needs and wants in their healing journey, and support legislation that allows for various forms of healing. And number five, address sexual harm comprehensively, including beyond criminal law. So then we pulled from a few of those, the larger document, and came down to these 5 categories for 2022. And the first one is the increased funding, which I mentioned before. The second one is enact protections for people who are LGBTQ through anti-discrimination legislation and banning conversion therapy. Number 3 is protecting employment. And here I provided several examples of what that could look like. Number 4 is empowering youth through education. And that can include, excuse me, through comprehensive health education, which has been shown to be a promising tool in reducing sexual assault and harm. I want to back up to number 3, the protecting employment piece. There's evidence that show economic stability also is a protective factor against sexual assault and harm from perpetration and victimization. And so that's why it's a key piece in this 2022 document. And the last thing is supporting survivors. And so this could be making sure that if someone wants to speak out and say something happened to them, that they aren't going to automatically be sued for saying what happened to them in public, for example. And then speaking out without loss of education or coming forward. And that's really lifting up students' educational needs so that if they are sexually assaulted while in school, that could be K through 12 or campus and university. So at any level of education, that they would know the process for response, and there would be protections in place for them to make sure that they don't have to drop out due to the trauma. They don't have to fail classes due to the trauma. So this is an important piece as well. So that's a wrap for KASAP's public policy agendas. And we're going to move on to the National Survivors Agenda.
It's been almost 3 years since millions of us raised our hands and voices to say Me Too.
Since then, we've seen incredible strides and experienced some amazing wins. We've also learned that we have so much farther to go to bring about the change we need to see.
We launched the Survivors Agenda to center what survivors in this country care about so we can build the kind of world we all deserve.
As a survivor and an attorney who has dedicated my career to seeking justice, the thing that I most want to see is institutions take survivors seriously and develop the systems that allow for justice and for healing.
As a survivor, the things that I care about most are ensuring that all survivors are heard and supported, no matter their zip code, immigration status, ethnicity, or any other reason.
There's power in our numbers, and an end to sexual violence needs all of us.
We are resourceful, resilient, and ready.
So one of the developments from the Me Too movement is the Survivors Agenda. And KASAP was at the table as a community partner to provide feedback on some of the things that came up, as well as to gather info. And we used this agenda to evaluate our own agenda. And what I think that the Survivors Agenda group did really well was the core issue was centering the voices of survivors, so that there aren't people who are just guessing or thinking what might be the best thing for survivors. It was survivors themselves saying, this is what we need and want. These are the issues we see, and let's put this together. They also centered survivor voices who were often left out of the conversation, and that includes Black, Indigenous, other people of color, queer, transgendered, intersex, non-binary, young, workers, immigrants, people who are disabled, and the currently or formerly people who've been incarcerated. And so these were key pieces to make sure that all the voices were heard. And so first, I'll just give an overview of their mission. And so they started with saying, we believe survivors should be the ones shaping the national conversation. The primary directive is to deeply listen to survivors. They also want to expand and shape a constituency of survivors, and they're calling for a change in the rules. So what does this mean, and how did this agenda develop? Well, it developed in many different ways. There was a steering committee of over 21 organizations. There were 60 plus community partners, and that's where we were engaged as a community partner. There were over 1,100 survey responses from survivors. There were national town halls that they hosted for feedback from individuals. They also did this really cool thing called a kitchen table conversation, where you could get together with a few of your friends. You could be at a kitchen table, you might be on the phone, you might be on a FaceTime, or however it is that you all are together. And you could dive into some of the questions that were posed. And so, for example, the question that we centered ourselves with in the beginning is, what would a world free from sexual violence look and feel like? That would be a question you could ask your friends. Someone would take notes, and you would send that in via their website to the Survivors Agenda to give feedback. I hosted a couple of those, one with our advocates, also hosted one with some friends. And they also hosted workshops. So as you can see, they tried to take a comprehensive information gathering opportunity to really shape this holistically. And so here are the values framework, that the agenda would be survivor-centered and led. The strategies to survive, heal, and take action would be included. That the agenda would create systemic change that interrupts, prevents, and ends sexual violence. We also know that sexual violence happens to all those of all gender identities. And we want to center the voices of the most marginalized and least visible. Additionally, the values framework is that change must occur at multiple levels: institutional, interpersonal, policy, and cultural transformation. Sexual violence does not exist in a silo. There are inherent interconnections with other forms of violence and identities. This is a space to welcome and hold experiences of people at any point along their journey. And they wanted to make sure to include language and disability justice so that all folks again could participate and their voices be included for what this agenda should be. So let's jump into the agenda. If you go to survivorsagenda.org, there you can find a vision guide, which is a condensed version of the agenda, and then the full agenda, which goes into detail, and it not only gives you an overview of the issue, but then if there are examples of how to address that issue that have either been tried or are being pushed right now, or even new ideas, there's a list included there. So that's really cool. You don't just walk away with knowing these issues are important. There are also solutions listed to address those issues. And I want to highlight a few. Another disclaimer is that because the Survivors Agenda is so thoroughly and well done, we don't have time in this 1 hour together to go over every piece from these broad categories that they have set out. So instead, I'm going to share just one or two solutions to each of these categories. And so the first one is community safety and alternatives to the criminal system. And so one example to that would be to end criminalization of survivors and people who defend themselves against harm doers. Another example would be decrease barriers to victim compensation. Moving down to the culture and narrative shift topic, some examples here would be promoting survivor leadership, as well as creating guidelines for the media that center strength while holding harm doers accountable. The next one down is education. Education would include things such as robust Title IX protections. And Title IX is a federal law that prohibits sex-based discrimination in schools. Another thing under the education umbrella would be to require universal, comprehensive, age-appropriate, medically accurate health education. Another one would be to require climate surveys. And I'll wrap this up with restorative approaches within the schools. Moving on to their other larger topics, healing justice. Healing justice examples would include funding of community-rooted and culturally responsive trauma-informed programs that serve survivors who are often ignored by the mainstream, and also ensuring that institutions are held accountable for covering up sexual abuse. Moving down to healthcare, some examples would be providing universal quality healthcare, health insurance, and having trained providers, and meaning trained providers who understand how to work with survivors and being trauma informed, and expanding access to mental health services. Moving down to housing and transportation, those will include things such as having affordable housing and tenants' rights, as well as reliable, affordable, and ADA compliant safe transportation. And the last one is workplace safety and workers' rights. And here some examples would be structural reforms that build power for women at work, including paid leave, access and affordable childcare, fair and adequate wages, as well as having robust anti-harassment, anti-discrimination preventative measures in place. So I almost feel like I'm not doing the Survivors Agenda justice by only touching on those things briefly. But what I hope you will do from here is be really encouraged and inspired to go and take a look at the agendas in full. Again, and you can find those at survivorsagenda.org. So let's take a breather. Whew, that's a lot. Between the KASAP's agenda and the Survivors Agenda, you have learned a lot tonight. What I'd like to transition us to, and where we will end, is sharing that while we look at the KASAP and Survivors Agendas, you can see those cover many, many issues. And we tried to be comprehensive in how we can possibly address sexual assault and harm. But what also exists are other organizations who have agendas which have a narrow focus. And that is so they can put all of their energy into one piece of these comprehensive agendas. And what you can find, and I'm just going to go over a little bit of these so that you know if there's an issue that you're working on, say specific to, let's go back to one that has been worked on, the child marriage issue. There is a national organization who that's one of the main things that they work on. Like predominantly, they want to address and end child marriage in every state in the US. And so partnering with them when that is their expertise and their, one of their only focuses would be very powerful if it's an issue that you care about. And so sharing these is so that folks know sometimes you don't have to try to figure out working with an agency who takes on every issue. There might be another agency where we can all work together who has a more specific focus. So there are specific agendas focused for communities of color. And here I would highlight the Women of Color Network, for example, as well as the Asian Pacific Institute on Gender-Based Violence. There are agencies focused specifically to address sexual assault and harassment within the LGBTQ community. Some that focus specific on workplace harassment, and that could be, and this overlaps with another one, but the National Domestic Workers Alliance or Justice for Migrant Women. So that overlaps with immigrant survivors, and their Sex Workers Organizing Project. And continuing on that would be school-focused agendas. So that can include campus and or K through 12 level education. And that a few of those examples would be organizations such as Know Your Nine, Every Voice Coalition, and End Rape on Campus. The Joyful Heart Foundation. And I originally learned about them because they were leading efforts to address the previously untested sexual assault kits around the nation. There's also an organization called RISE, which focuses predominantly on creating a survivor's bill of rights. 1 in 6 focuses on men who've been sexually assaulted or abused. And there are many other organizations that we haven't touched on. And so a few of those that are more on the national level would be National Women's Law Center, Equal Rights Advocates, as well as the National Alliance to End Sexual Violence. So hopefully your wheels are turning and the insight provided will let you know what's out there. And if there's something that you want to see is out there, but you haven't been able to find it, feel free to reach out to me and I'll see what I know and what I can share with you. And I'm happy to take a look and help guide folks in the right direction. So we're wrapping up. But I want to say thank you, and we hope to see you in part 3 of our Legislative Advocacy Series, where we're having a panel of 5 phenomenal Kentucky State legislators from both the House of Representatives and the Senate. And we have several folks from leadership, as well as some wonderful up-and-coming legislators who care about these issues. And we're going to hear from them about why this issue is important to legislators and in Kentucky. But also, what are some tips for you if you wanted to advocate and contact your legislators? And what can we expect for 2022? So we hope to see you there, same place next week. And here's contact information if you have questions or you just want to follow up. There's my email in the first box, our office phone number, and our website as www.kasap.org. You can follow us on Facebook at KASAPINC. You can also follow us on Twitter at NoMoreKY. So thanks again, and I hope everyone has a great evening. Take care.